purpose of our research is to explore and understand the impact of the COVID-19 pandemic on final nursing students' perception of their clinical preparedness, and particularly looking at the educational support they were getting during that period, and any impact on their professional development for the future as they're transitioning into clinical practice. So we're using our mixed methods approach. We're using a survey that was sent out to all final year students across our programs in the School of Nursing. And we're also conducting or have been conducting some in-depth interviews with select students, again, across all of our programs of what their experience has been over the past year.
Well, we're hoping to really see how the pandemic has affected our nursing students. As we know, the global COVID-19 pandemic has disrupted multiple levels of society. And as everyone was coming into their homes and staying safe, many of our nursing students were taking active action and self-deploying themselves into their summer workplaces, whether that be the long-term care setting or the hospital, and for many continuing on with their education. And then upon return into and prior and into the second wave, we want to learn how it may have affected their use of virtual learning environment.
Because of the pandemic, we had to take our students out of clinical, and we're a practice profession, and we spend a lot of time in clinical practice. And our students, that's where they create praxis and they understand the theory that they're learning, and then how it impacts them as real nurses. So when we faced that dilemma, we had to take them out of clinical. So we wanted to see, we wanted to get their perceptions of what we had done as a School of Nursing to support them in still learning about clinical practice while not really doing clinical practice. I think the one thing that we wanted to find out was how it impacted students, because it was a huge disruption to students, and it was very different than what they were used to. They were going online. A lot of them hadn't been online for even their theory courses, and so to put both theory and their clinical courses online was, we felt, was really something we wanted to know about, to look at for the future. And we also wanted to see how they felt about what it was doing for them as they prepare, especially our fourth years, to go into clinical practice and be graduate nurses, very shortly thereafter. So we felt it was important that we try to get to a sense of that, of their understanding of what was going on and how they felt it was helping them.
Touching on what the other ladies have said, you can't overstate the value of being able to gain some comfort on the floor of a hospital. It's like night and day. Once you've been able to have some clinical shifts and to be able to repeatedly show up to that floor, you gain that comfort, and then you can carry that with you on into your practice. And to not be able to have that in some of these settings now because of COVID, it's unsettling. It brings a lot of emotions, a lot of things we're doing online, and it's just not the same. As a nursing student, there's a lot of different ways that our clinical has been made up online. And it all involves being on the computer using various virtual stimulations. And to know whether or not this is going to help other students as much as it helps me, or one is better than the other, or whether or not, this is something worth pursuing. Are we learning more in less time? Does it take longer on the online form to learn what you would learn on a clinical rotation? There's a lot of things that we don't know, and it's all about making sure that the nurses that are coming out of this program, even though they haven't been in the hospital as much, feel ready and have learned everything that they need to know to be able to deliver that high quality patient care that they have for years.
It's important that we as faculty understand the impact of using VSIM, because that's part of the reason we did this study. And I think it's important that we know that, despite students being, the discomfort students experience, I think it's important that we also look at the efficacy of what we're using.
So the simulated environment does provide an opportunity to have discussions that bridge the gap between theory and practice. So our aim in this study is to really look at practice readiness in an altered environment due to the pandemic.
Our research will be of interest to numerous stakeholders, nursing educators, nursing faculty. Some of the impacts of the pandemic will stay with us for a while. So how can we move forward in including some virtual learning and alternatives to face-to-face placements in a meaningful and effective way? For patients, some reassurance that, whilst those students are not practicing these skills in a physical environment, they're still being prepared to safely and effectively care for our patient communities, because certainly there will be a shift in the kind of nurse potentially that will be graduating out of this pandemic compared to previous generations of nurse graduates. And I think that's already been recognized. We now, through virtual advances, have these opportunities to still immerse students in critical thinking around acute cases, chronic care scenarios, and so forth. How we would take this study forward is to look at other cohorts of students as they progress through the program, because we're all realizing that this pandemic is not just affecting the graduating cohorts, but will affect nursing graduates for the next 2 to 3 years, as this pandemic evolves.
Taking the best of what we knew from before the pandemic and carrying over what we've learned, our lessons learned from the pandemic, and really pushing our faculty of nursing and schools of nursing across the country to reimagine the best practices in nursing education.